just to introduce, my name is Radhika Agrawal. I am the co-founder of We Design People, and I am currently a service designer in Singapore. And Teeth is my colleague and my team member in We Design People, and he's a UI UX designer. I'll also be having academic and career related talks. I won't give out too much about what this is going to be, but it's definitely going to be really useful and handy for people who are still figuring out their career paths or their next academic path, like for example, doing their masters. And lastly, we'll have some casual get-togethers just to know the community better, virtually, and if possible, in person as well for those who are currently based in Singapore. So, of course, scan our on the community, and more people understand what design is about, from a thinking perspective and from a doing perspective. So please follow us on our Slack channel. I'm with this screen here for a bit for you so you guys can scan it. And if anyone needs the link, it's here as well. I see some. Let me know if your voice is cracking up, if it's okay. I'd love for you guys to just unmute yourself or just turn on your videos, so we can all say hi to each other. I think it'll definitely be a more fruitful discussion that way. Thanks, Vikram. I think we'll just give it a minute or two and wait for more people to come in. And in the meantime, let's really get to what we all are here for, which is our talk for today, service design in the public sector, which will be presented by Saumya Singhal. So if you think the same, we'd love, I think later on we'll have a Q&A session as well towards the end of the talk, but you can leave your questions in the chat box. And when we do have the Q&A session, please feel free to unmute yourself and just have a discussion with Saumya here as well. Take this opportunity to learn from her and get to know more about it. Okay, I think we can start. I'm gonna hand it over to Saumya.
Thanks, Radhika. I'm not sure if we could hear you very well, but I'll just introduce myself as well. Hi, everyone. I'm Saumya, and I am a service designer. I work in local government in England, and I'm here to just sort of talk about my journey, my reflections as a service designer and the sort of projects and things that I work on, and hopefully give a flavor of what service design can look like in the public sector, which is something that I'm passionate about. So yeah, thanks, Radhika. Can you hear me, Radhika?
Yep, I can.
Okay.
Are you able to see?
Sorry?
Are you able to see my screen?
Yes, but I see your WDP slides.
Oh, okay.
Yes.
Okay, great. Sorry about the delay. Yep.
Great. Thank you, Radhika.
Yes.
Okay, perfect. So I just introduced myself. So if you could move on to the next slide, please. So I'm just going to start from the very basics of, what is a service. And Lou Down, she is, the ex-design director for UK government. She's said this quote really well, but everyone, has this notion that a service is something that's long and complicated, that's difficult to understand. But it actually, next slide, please, is something that helps someone to do something. And it could be about, I don't know, booking a cab, it could be about checking into a hotel, but for me it's more about looking at perhaps the sort of support that you could get if you're facing domestic violence, or the sort of housing support that you would want if you're at risk of homelessness. And those are the sort of public services that I work on. Next slide, please. So what is a public service? This might sound, everybody knows what a public service is, but I just thought it might be good to reiterate some of this, just because, we all come from different contexts, and it might be, every public service is different in every sort of government. But yeah, essentially a public service is something that's organized and delivered by the government or an official body to benefit, each member of a particular society, and includes things like healthcare, transport, social care. Like I said, every government has a duty to look after their citizens, but each country is different. It depends on sort of, how much of a welfare state it is or not. Oops. So I work in local government in England, so I thought it would be helpful to also sort of give a little bit of context about what public services look like here, which is the next slide. Right. So, what does local government work? How does it work in England? So the whole country is divided into these sort of local authorities that are responsible for the provision of sort of almost all the public services in the area, and they're responsible for, the citizens, the residents living in that area. And it's, the size and everything is different, is based on sort of population density, area, things like that. And just to mention that sort of each local authority has a sort of political and administrative independence. So you are sort of free to, play around with the sort of services that you offer, which sort of are about the kind of residents that live in the area, the sort of needs that they have. So you can tailor your approach that way. Next slide, please. So where do I work? I work in the London Borough of Barking and Dagenham. It's in East London, and something that really is unique about this borough is that it's one of the poorest and most deprived boroughs in London. It has a huge multi-ethnic population. So in the past, I don't know, maybe 20, 30 years, there has been a large influx of Black, Asian, minority ethnic groups, which is a very sort of key demographic for us. And there are really high rates of sort of, issues such as domestic abuse, homelessness, crime, and unemployment. I would say that those four are some of our, most major wicked problems that we deal with. And like I said before, the local authority, has a duty and responsibility to respond to these specific problems that are in our borough with, the kinds of policies that we design, and also the sort of services that we offer. Next slide, please. So just a quick overview of the sort of public services that I'm talking about. It could include things like children's safeguarding, which is basically when you're trying to safeguard a child from risk of, neglect or abuse. It's hard stuff, but it is, it's a duty that your local authority has. Similarly for adults as well, which includes, stuff like domestic abuse, mental health, etc. Education is a big one. Also welfare assistance, which is basically, if you're below the poverty line, or if you have certain issues in your life, we can support with, welfare, monetary support, waste collection, road maintenance, so stuff like that as well. And also housing. So we have social housing for people who can't afford private rented property. So your council will actually offer you social housing. So that's sort of an overview of the services that are offered. And and the citizen, the resident, is basically at the center. And because the services are so varied, from even who collects your recycling waste is done by the council, to if you're going to get homeless, you come to us and we'll give you a house. It's almost, it spans across different levels. So it basically touches the lives of every resident living in the borough. Next slide, please. And that was, I wanted to touch on that just because of where I sit in the council. So we basically I work in a team called the Insight and Innovation team, which sits in the middle. So it's almost like a cross-cutting team that works with all of these different services to help and support with things like data science, service design, behavioral science, because we are a team of these three disciplines. And we essentially try and look at how we could improve our services. And, we aim to do mainly two things. If I want to really simplify it, it's one, to sort of have an evidence-based practice in the council. We hold a lot of data. Our team especially holds a lot of data on our residents. We do a lot of data analysis. We can identify sort of what are the needs, what are the emerging needs, how are residents' outcomes deteriorating, improving, things like that. So we have a big role to play in sort of championing an evidence-based practice in the council, but also we have the innovation and experimentation wing, which is more of the service design, behavioral science aspect to it, where we can, we have the freedom to sort of test new things and inform services and policies. Next slide, please. So I think that leads me to service design. And the question here for me was, how do we enable an evidence-based practice and actually try and trigger some innovation in this large organization? And for me, this is where service design plays an important role. So I'm going to talk a little bit about that from now. Next slide. So this is my definition of service design. You would ask any service designer, they'll have their own sort of definition, which is very tailored to their practice. But for me, in my organization, it's basically an approach where we're able to use it to define sort of the right problem to solve while putting users at the center, but also develop solutions and services that are, in the sweet spot of desirable, viable, and feasible. Any fellow service designers here would know that this is used very often. But basically what that means is that by desirable, you want your service to meet the right needs. So you want to meet your customer, your user, your citizen, your resident, whatever their needs. You want it to be feasible. So you want your organization to be able to not handle, but to be able to deliver that service, to have the sort of operational capabilities, the system infrastructure to deliver that. And lastly, it needs to be viable, of course, profitable, and it needs to be, economically as well as environmentally sustainable. So, it's not something that we often are like, okay, does this service do all of these things? But you try and incorporate bits of this when you're designing a service. Next slide, please. So I thought I'll specify some key principles that I think has helped me understand what service design is, how it can add value to an organization that already does great things. It already offers services. So how can service design help with that? So I think the first one, a very popular one for service design, is about being user-centered, and what that actually means is that it basically focuses on users and their needs, where you're trying to understand your customer, your user, your resident, to see if what you're delivering, your service, your product, or whatever it is actually addressing their needs, behaviors, motivations, all of that. Next slide. Sorry, next, please. The next one is about collaborative process. So service design, in essence, is very collaborative throughout the process, which I'll talk about in a little bit. You are engaging with beneficiaries, staff, stakeholders, everybody involved to sort of shape and develop solutions together. And that's quite a nice value add, because you don't see that very often in organizations. The third one is having an experimental and low risk approach. And service design essentially is like, test things small, test things quick, so you can learn fast, you can fail fast, you can quickly change things, and you can move on to the next, better version of that. So this is definitely something that we bring to the council, where we test things on a small scale and are able to inform, bigger sort of strategies and policies as well. Next. And lastly, this is a very personal reflection, but having a systems mindset, that sounds a little bit like jargon, but I think when you're working on something, I think the service design approach sort of tells you to look at, connections and relationships in other areas as well. So when you're, either you're defining a problem or you're thinking of a solution, you're actually looking at joining the dots. And this is, I don't know, it's something that's come to me with practice. Next slide, please. So now all of that I'm sure it sounded pretty high level. So I just wanted to take you through the process. It's a very famous double diamond, which is quintessential service design framework. It was created by the Design Council, and it basically talks about how when you're defining a problem, when you're in the first, if you see the first diamond, it's all about discovery and defining. So you're doing research, you're trying to understand your problem, where you're going divergent, you're going thinking big, then you're sort of converging to this point in the middle where you're like, okay, so what is the problem that we're trying to solve? And then the second diamond is sort of about solutions. So how do we co-create solutions? How do we test them? And finally come to a sort of final solution of this is what we need to deliver to address the right problem. Now, again, I'm not going into detail in this because I actually wanted to spend a little bit of time in explaining how we've adapted that to our practice. So next slide, please. So it's essentially the same double diamond, but I think we've sort of edited it just to fit our needs a little better. So the first thing is, I think we start with a sort of challenge or a research question where, I don't know, a service comes to us and says, we have a huge problem of debt in the council and we need to do something about it. And they have some idea of what's the issue, but not enough to be like, okay, so the answer is X. So which leads us to the first diamond. So if you can go next, about explore and research, which is basically about gathering quantitative and qualitative data to understand the problem, understand the users, understand the system, understand the processes that work right now. Just basically a huge piece of like deep dive into how things work currently and who are your users and what do they need. And that could include stuff like interviews, shadowing, mapping, all sorts of different tools. I'll go into a little bit of those tools when I explain a few projects, just because I feel like it helps when you put it into context. And of course, if you have any questions, you can ask me later. The second one is sort of about synthesizing. So you've gone out, you've done a lot of research, you found a lot of information, and now you're trying to make sense of it. That's what the second half of the first diamond is about, where you're trying to synthesize that data that you collected to generate actionable insights. And I think actionable is a key word here because you want to translate that into a solution. It's not just about, homelessness is a big problem and lots of people who are homeless also face domestic abuse. Okay, but sort of, what are the opportunities that you're deriving from it? Which leads to the next one, where you define certain opportunities to improve, but also, you define certain hypotheses. So if we improve people's debt, they will have better mental health. So that's a hypothesis. And then you also have you're defining how you want to change that. So that's that little small blue box in the middle. And that moves us on to the second diamond, which is all about thinking of solutions and exploring possible solutions. So the way we do it is through sort of workshops. You're meeting up with everyone that's been involved in your research phase to sort of be like, okay, right, so these are the problems, these are the opportunities we've identified, and now we'd like to think of solutions to address those. So we do that through workshops, we create quick prototypes, we test them. So that's all part of the develop process. If you go to the next one, it's about testing and making the case. So once you've come to an okay point where you're like, okay, so this is the solution that we want to test. We think it's going to make a difference. You test it, but also really important, you evaluate it. You evaluate it and you sort of refine your solutions with the same people that you've been generating your sort of ideas with. And this is, obviously it's a really important point in the journey because you're actually getting feedback from your users, from your stakeholders. Next, I think this leads us to this point. Again, all of these little blue boxes are important points in the whole process, but this one is about, so we found out that this sort of helps making an impact. These are the sort of initial numbers which show that what you've designed is helping in this, and this way. Then I think there's this sort of strategic decision point of like, what do we want to do with it? Is it going to add enough value? You do a cost benefit analysis. You see whether you have enough resources in your team, in your organization to actually implement something like that, which leads us to the next one, which is actual implementation and scaling. And my opinion, it's the hardest bit, because you test things on a small scale, it's still easy, but then to translate that into an actual scaled up intervention is the hardest bit. But this is where you sort of roll something out still on a smaller scale. Again, I'll give you a couple of examples later, but enough to gather enough feedback. So you're evaluating it, you're seeing whether it's actually made a difference, you're seeing if it's, I don't know, bringing back money to the council, if it's saving people's lives, or whatever it is that you want to measure. So that's the whole framework. I feel like I've given too much information in too little time, but it is what it is. Next slide, please. Right. So I just wanted to speak a little bit about the different outcomes of the service design process, because it's really a range, and it could be anything. So on the left, you have sort of the level of pace and timescales, and then on the right, you have the sort of level of complexity and scale. And there are different outcomes that can emerge from the whole service design process that I just showed you. The first being the design of products and communication. So that could be, I don't know, you develop an app, or you develop a website, or it's about specific tangible sort of products that are the answer to something that you're trying to solve. Next, please. So the next one is sort of service interactions, which would be, like experiences. So you would have, I don't know, user experience, user interface, different touch points in your journey where someone would interact with an app, for example. So that's, again, the sort of service interaction, but not just about the product, but about the whole experience, if that makes sense. Next, please. Then you have design for service systems, which is where I think our work sits best, where you're designing new processes, new ways of working. You're changing services, but not just like one bit of the service, but you're actually trying to modify the entire service. So that's more of the whole, service system bit. And then the last one, which is the hardest and the biggest on the larger scale, is design for policy, where, what you've designed is actually influencing strategic decisions and policies that are made in the council, in the government. And it's not to say that one is more important than the other, because you can start small, but it could make a big impact. It could have a ripple effect to even design for policy. So I think that's something very very important for us, where sometimes we start small, or we just find a way to have those conversations with, say, I don't know, a small product, but it leads us to bigger conversations that could actually influence services, entire service systems. So yeah, next slide, please. Right. Again, lots of high-level theoretical information, but what does that mean in practice? I thought it would be nice to give a couple of examples, and also show sort of some practical tools that we used in the process to try and make a little bit more sense of it. So next, please. So the first case study that I want to talk about is about breaking silos, which is basically getting different services to work together in order to have better outcomes for children. So in order to safeguard children. So I'm sure most of you know what safeguarding children means, but again, the council, schools in England have a duty to look after children, to identify if they think something's going wrong with the child, if they need to intervene and support that family. So what was our brief? We work with primary schools. So primary schools are the first point of contact for children and families, and of course play a huge part in supporting vulnerable children in England. Schools can link up families to the right support, such as, I don't know, parenting services, mental health support, or even, if say a school staff, the right professional, of course, thinks that a family is not fit to care for a child, then they could actually, pass the child on into the council's care. So even as extreme as that. So what we looked at was how schools could actually prevent certain poor outcomes for children by two things. One is identifying children at risk early, and also supporting them quickly. So that was our brief. Next. So we did the whole research, discovery, everything. And what we found was that in schools, signs of neglect weren't getting detected early enough, because sometimes it might be difficult to identify something's going wrong with a family without having sort of a holistic view. Like if I knew that a family is at the risk of being homeless, where they're almost about to lose their house because they're in debt, I might sort of understand why a child's coming to school with no socks, for example. So, having that holistic view is important, but this wasn't happening in schools because they just didn't have that information. The second one is, related to that. So there is a lot of very crucial information on the family that we hold as a council, but it's not shared with schools, who are this first point of contact for the child. So there seemed to be a mismatch. For example, there's an example here that I've put, which is the family known for a case of domestic violence? That would be a pretty important piece of information that a school safeguarding professional should know. So that was the sort of challenge that we were working with. Next slide, please. So to dip into a little bit of what our process was and some of the tools that we used. So in the research phase, we shadowed school staff, try to understand what they do, what safeguarding means for those school staff. We interviewed them in schools to understand what they did, how they helped children, how they safeguarded children. But we also spoke to sort of from the council side, we spoke to social care workers about, how do you get referrals from the schools, things like that. Then the picture at the bottom is a picture of us actually mapping the whole, everything that's involved in this system. So I think it was about sort of mapping the journey of, what does the school staff do when they see someone come in with no socks, to like, how do they send them, I don't know, to the right support, which would be really helpful to actually get socks back onto the child's feet. That sounds very, try to simplify it very much, but that's essentially what it is. And then we sort of synthesize all of that research. So what that means is, once you've found a lot of information, you want to try and identify certain patterns that are emerging. So what is it that you're actually trying to solve? So I think we did a lot of that. And there was a clear pattern that came up, which I'm going to talk about in a minute. We also sort of, put very clearly on paper, what are the barriers and how can we improve them? Because then it was helpful to take that in front of school staff and be like, look, this is what we think are the barriers, and this is what we think are opportunities to improve them. What do you think? How can we prioritize these? Next slide, please. The second half, which was, okay, we found out what the issue is, now we want to develop solutions. The second half was, this project, we followed like the traditional service design methodology with all of these little diamond pieces to answer this big question of how can we break silos to safeguard children. So in the develop phase, we had a lot of workshops with staff to, come up with solutions. You can see on the bottom, that picture is basically us trying to hold this workshop on PowerPoint. And, as service designers, you're usually using much more high-tech digital tools to do stuff like this. But the audience that we were working with weren't very tech savvy. So you have primary school teachers who've, basically not used some of these digital whiteboards and things like that we use. So we try to adapt it to that scenario. We also really worked closely with sort of the technical support team, because what we came up with was a technological solution, and we needed that support. So we worked very closely with that team. Next, we tested this solution, which I'm going to tell you in a second, but we tested it with the staff. We got feedback. We understood what needs to work, what we need to improve. We developed that. We again released it back to the schools. And then we basically let it run over a period of time to monitor impact, usage, and if it's made any impact. So what is it that we actually did? If you go to the next slide, please. Click once more. So we developed something called this information portal. What we found was that information wasn't flowing from the council to the schools, who are the first point of contact of your children. So what we did is develop this platform that allows safeguarding teams in schools to access crucial information about children and families at risk. Now, it sounds really simple, but it was really, really difficult. This sort of information exchange hadn't been done before between the council and schools. So it was a huge task to actually, jump through hoops for data sharing, to sort of understand what value is it going to add to your residents' life, things like that. But essentially what this portal does is that it pulls together data from across the council and gives a quick sort of summary overview to the school. And this essentially helps schools to look up a child, identify if there are any other issues happening in their life, and then, therefore able to help the child and the family earlier and quicker. Now, the little mock-up that you see on the left, it's just that, it's a mock-up. So we used an existing sort of software to develop this. And it was less about the sort of UI, UX of the digital tool, to design the actual tool, but it was about all the back end of to actually make this exchange happen. So that was, in my opinion, the actual solution. Next slide, please. And just, a quick one on what the impact was. So of course, there was really, really good feedback from staff. They basically said, this is something that we've always wanted. So very happy to have this. We piloted this with 3 primary schools that were involved in the project. The feedback, like I said, was excellent, but usage was not as high as we expected. We expected, people to look up children like almost every week. You would find that a school staff has identified a child in need. So we expected that, but that was not so. And I think that was a learning for us of anything new that you add to business as usual or someone's normal practice is going to take time to get embedded, which was fine, because then we worked with the staff to be okay, use it in this scenario, use it in that scenario. And of course, it helped. And the last bit is just about how the children's services are now planning on commissioning this again to sort of roll it out more widely across more number of schools. So all in all, I would say it was a success. Next slide, please. And then, because this is a talk on service design and we want to, have a conversation about the sort of how it helps and how it doesn't help, I thought I'll put some of my reflections. So the first one is that data sharing is very hard, like I said. On the right, you can see this little, I don't know, it's a call, but we're trying to basically identify use cases for this information sharing. So we had to give we had to be very clear on the value add of this new thing that we are developing. So we basically got into a room with a lot of people a lot of times to identify where all this tool could help and why. And that really helped with some of the data sharing conversations. The second point is getting all the right stakeholders in a room, of course, is very powerful. And I think that is even more so if the conversation is structured. So I think as service designers, we are really able to structure a conversation. You go in a room for 2 hours. In the council, I have been to conversations where, it's a 2-hour call with a lot of people with no clear sort of structure to the conversation. There isn't a clear, what are we doing about it? How do we, what are the next steps? And I think service design methodology comes with certain tools and things that you can use to sort of structure a conversation. So that's where I think, SD is quite helpful. The third one is about starting with quick wins. Like I said, I think in the outcome slide, I think to start with quick wins is very powerful because it gives you the buy-in to then move on to bigger conversations. So that's always helpful. And then the last one is, just my reflection of that. A lot of service design is facilitating conversations, but also just synthesizing and breaking down really complex information into simple things that everybody can understand. So that's my reflection from this project. Next slide, please. Just the last case study, and then I'm going to shut up. So the second one is about sensitive debt collection. So this one is about debt and housing and, poverty that a lot of the residents in Barking and Dagenham face. So what is the brief? Debt is oftentimes quite indicative of complex issues in a person's life. Residents in debt are more often than not facing sort of challenges, wider challenges like poverty, poor health, domestic violence. I keep saying domestic violence, but that's because it's a huge issue in our borough. And if left unchecked, if the debt is left unchecked, it could definitely lead to evictions, homelessness. You go to court, your house is taken away, all of that terrible thing. So we looked at how we could improve our debt collection by intervening early, because moving on to the challenge, our debt collection service was quite transactional and only properly engaged with the resident during crisis points. So it's like you're, I don't know, 2,000, 5,000 pounds in debt. We're taking you to court. Then they reach, they all go to the court and they realize that actually the resident is, has such terrible issues going on in their life that they can't pay. So then they sort of offer support. And it's oftentimes quite at the end in a crisis point. And the focus was always on debt collection rather than sort of providing a holistic support. Next slide, please. So this is a project that I wanted to talk about because it didn't follow the traditional service design methodology of like 1 diamond and 2 diamonds. It was just basically everybody knew what the problem was. We just, there were a lot of conversations to define the problem as well, where we would get in a room to sort of understand, what exactly is the issue, but also for whom. So trying to identify the right sort of people that we want to work with and we want to test something new with. We knew we had to test something new. We just didn't know what it was. But also, I think a very, very key point was to identify the right kind of group to test this with. And I think here, there was, at this stage at least, there was a lot of, it was very data-led, which was really good. Because service design can't do everything, of course, but the data science bit really shined through here because they were able to help identify which indicators sort of best identify the most vulnerable groups that could do with this new service that we are trying to develop. Next slide, please. So the second half, this bit where we developed a new process flow was the actual work that we did, where we co-designed a new process flow for debt collection, but which involved offering support, a holistic support, right from the very beginning. And in that process, we set up staff, resources, digital systems, etc., all of that to enable this new process flow. So as you can see on the bottom, this is the first time we got together in a room to try and map the process, and that evolved into very messy charts that wouldn't look good on this slide, so I've not put it, but that was what the process looked like. And then I think, of course, the big thing was about testing it. So we piloted this new approach through by actually doing a randomized control trial, which I'll tell you in a minute. And very important, we sort of had the data to measure outcomes for the group. Next slide, please. So yes, so what is it that we actually did? We basically tested a new proactive outreach process where, number one, we identify vulnerable residents, and number two, we proactively contact them to offer support. It might sound really simple, but honestly, this was really like game changing for the debt collection service because it brought in a relational approach. It said, we are here to help you, not give us all your money. So it was a really like big shift in the relationship between sort of the council and a person in debt. So point number one, we identified a cohort of residents, of course, that had complex needs, lots of debt, etc. Second, we split them into 2 groups. So one was the treatment group that got this new process. The second is the control group who just went through process as usual. And this was basically so we could compare the 2 and see if one made a difference over the other. The third point is point number 3. We sent this treatment group personalized texts offering support from our specialist debt service. And we have a behavioral scientist in our team who basically, supported with how we could draft this text, essentially, using behavioral science principles to engage with the resident more. So for example, a very small thing, but even saying, my name is Jill and I can help you is actually really important because it sort of personalizes it, it puts it into context, it humanizes it. And something so small actually, makes a big difference. So yeah, we drafted these texts and we sent them to residents. And then the service that actually offered the support basically called the residents that responded and worked with them to resolve their issues, which ranged from sort of completely canceling their debt to getting some money from the council to pay off their debt, or even, paying it in increments, so slowly over, I don't know, like 6 months. Next slide, please. So just a quick one on the impact, because that's pretty much the key thing in this project. We contacted 200 residents and engaged with 1/4, so 50%, 50 residents. But to the ones that we engaged, we delivered a lot of interventions, 130 interventions to them. The treatment group showed significantly better outcomes than the control group, and I'll talk about that. For example, we collected almost 75,000 pounds of additional debt over 4 months from the treatment group, which is a lot of money back to the council. And then we gave about 300,000 pounds of additional benefits to the treatment group, which is crazy because that means that these people were in such dire need that they were eligible for so much of benefits. So we've handed over that much benefits. Households in the treatment group were also more positively impacted. Like you can see that graph on the left, basically like stuff like crime, education, they had much better outcomes for the treatment group. And also just lastly to say that now this approach is like embedded into the debt collection process. And we're also looking to replicate the same model to other areas such as unemployment. And of course, in perfect service design fashion, there's a quote here which says that, it really changed the resident's life, where this person had been suffering depression and was afraid to open any letters from the council. But once we called them, once we sent them a text, they felt like like a, what does she say? A weight has been lifted off her shoulders. That's always good to know. Next slide, please. So yeah, just again, quick reflection on this project. So of course, implementation and scaling is the biggest challenge because of many things, but like lack of resources, lack of funding, resistance to change, and also sort of difficulty in changing business as usual because people are doing their day jobs. They're working how they always work. And then you come in and add this additional layer of, okay, now we're trying to change things. And they're like, oh my God, go away. Like we don't have time for that. So definitely implementation and scaling is difficult. Robust evaluation can definitely help support change. I think when I was studying service design, there was a definite lack of conversation around evaluation and testing things more robustly. And I think I now know that it's very important and it's a great way to sort of measure and demonstrate impact. And lastly, I think very obvious, but always striving to be multidisciplinary. So in this particular project itself, service design helped sort of design that new process flow. Behavioral science helped design the actual intervention that we delivered to enable residents to engage with the council. And data science was like the king of this project, where it helped identify the right cohort, but also evaluate the trial. So that was a huge thing. And then, yeah, just to sum it all up, I think, service design is great, but it can't solve everything. But it could definitely help with sort of having an, in-depth understanding of people's needs. So definitely, having your services user-centered. Second, making sure that the service is addressing the right need. So, being able to define that problem really clearly. The third one is sort of increasing buy-in and adoption because of how essentially collaborative the process is. Fourth one, like I mentioned many times in this call, testing solutions small and quick, which is very low risk for organizations because you have nothing to lose when you test things on a small scale. And lastly, sort of producing evidence-based solutions that could then be scaled and implemented. So starting small and going big. That's it. Thank you. I'm going to stop now.
Thank you so much, Saumya. I think that was very informative for everyone here. And I think I learned a thing or two about service design as well. And some things that Saumya shared, like behavioral design, data science, I think I'm also getting, I'm quite exposed to that now as well with my new, my new job, where there are a lot of behavioral scientists and data scientists as well. Um, so yeah, maybe moving on to the questions. We have a few questions here. Maybe we could have Vikram. Do you want to share your question? Do you want to ask a question? You're on mute, sorry.
Yes,
Yeah.
sorry for that. Yeah, so thanks Saumya for this informative talk. Yeah, my question is regarding about red tape because sometimes, with government policies and all that coming into design and all that, uh, how do you think that that actually affects the design process in totality? Yeah.
Good question, because it's a huge thing. It's, you can't forget about red tape when you're designing things from the start. If you are having those conversations, if you've involved the right people in the conversations from the start, you know the constraints, you know what red tape you're dealing with, so you're able to design around it, or you're even able to, have conversations or challenge the people putting those red tapes to rethink certain things. So I definitely think that sort of collaborative aspect and involving them early on in the process is helpful. But yeah, no, there have been so many times where we just have to give it, we just had to give up pursuing certain things because we're like, okay, this just can't happen because there's too much red tape around it, and I've made my peace with it by now.
Thank you. Yeah.
Thanks, Vikram. I hope the Soumya's answer uh, was ample enough. We have another question by Elena. Elena, would you like to ask a question?
Sure. Sorry, I don't have my camera on. It's the end of the day here, so looking a bit worse for wear. So my question is really about when we do successfully implement something, how common is it for service designers to go back and review a service or process? Or for you personally, Soumya, did you have an opportunity to review a service afterwards?
Yes. So I think more often than not, you design something and then you leave it because you've done your bit. You've handed it to people, and you're like, now use it, do it, make it happen. But it just doesn't happen. It just doesn't work that way. That we have had so many challenges in, we've designed something perfectly, people have given us great feedback, we've sent it, we've given it to them, okay, now use it, and then you basically come back 6 months later and like no one's used it, no one cares about it, and you're like, but why? You told me this is what you needed. So what's the, what, there's a mismatch there. But I think this was sort of on my point of, it's really hard to embed things into business as usual, and it really needs a service designer to revisit what you've designed and be like, what isn't working, what can you do to actually facilitate that process? Is it about going to a lot of team meetings and telling them, hey, what's happening, can we help? Is it just about showing your face to, actually make it work? Or is it there's a very key sort of flaw in what you've designed that's stopping it from actually being successfully implemented? So there are a lot of reasons, and I think it's definitely important to revisit. But sadly, a lot of times you don't have the capacity to keep going back and making sure something works after you've sort of gone through the whole process and designed it completely. But yeah, I think it's definitely a long process where implementation takes a long time. For example, the partner information portal that I showed you guys, that was 1.5 years ago, and we're still in the conversation of how can we improve it? Is this exactly what you need or not? So I think, yeah, you basically never stop if you want to be successful in your implementation. I'm putting quotes because success can mean many things, but yeah.
Yeah, thank you so much.
Hope that answers your question.
That was a great question, Edwina. Thanks for that. Okay, next we have Soki, if I'm getting that right. Maybe you could ask your question as well as maybe just share what you're currently doing, if you're a student or working and in which sector. Okay. Okay, maybe I'll just read the question out. So I think There are two parts to the question. So the levels infographic that you showed was very interesting, starting from the product feature level to policy change. Could you reshare that? So is that something
Yeah,
that you can share, Saumya? Okay,
I
great.
can share it, but do you want me to? I'll share it after this, right?
Yeah, yeah. You can share it with me and I'll send it to everybody. And the second part is how do you find workplaces that work at higher levels of systems and policies?
I mean, I can only speak for public services, but essentially every public service would have levels where you would have, frontline workers who do like the day-to-day actual service delivery to like people making policies and making strategic decisions. But I would say it'll be the same in even in private sector organizations, large organizations where there's always levels that you can affect change in. So yeah, but if you're interested in public services, I think personal opinion, but it's a great place to practice service design and actually try and improve people's lives. Yeah, I don't know if that answers your question, but I don't know how else to answer it.
Yeah, and I think just to add on to that, we are looking at collaborating with Saumya to do a workshop as well on service design, specifically in public services. So that should come up in the next few months. So do look out for that. If you really want to understand what service design is like and how to apply it in public sectors. We have two more questions. By one is by Faith. Faith, do you want to read out your question and also just introduce yourself?
Hi, Faith. I was in public service, so I think one of the key issues is, especially for government officials, they are very, very busy with a huge workload. And from what I see from your experience, what I'm impressed is the amount of time they actually give to you to actually talk about the issues, the challenges. So there must be quite a number of hours they have invested out of their busy workload to actually work with you. So there must be some sort of buy-in, especially if I understand correctly, are you or is it like a third-party agency that they hire you, or are you in-house in general, and how do you get them to actually devote the time to you? Yeah, thank you.
Thanks, Faith. I just written down some of my answers because there were three. I think there are many questions in this one question. But yeah, we are an in-house team. So we work in the council and we basically, I think that's the good part about it is that we don't get extra paid. So we're just, council employees and we can basically support with different services in the council with whatever it is that, whatever their needs are. I think about buy-in, definitely. I think firstly, it's about having buy-in for the challenge that you're trying to solve. So I think, what we work on are definitely council priorities. So debt, homelessness is a big priority to the council. Unemployment is a big priority to the council. So these are like conversations that are ongoing. So, you can just plug into an already existing meeting that's happening to discuss unemployment and you get so many insights about, what are the issues that staff are facing or what does the data tell us. So definitely working on priorities that are there in the council. People aren't always bought into like the service design process. And it's not like we say, okay, so are you ready to do service design? We just start doing it. We just say, okay, do you have like, I don't know, 2 hours to, never 2 hours, sorry. Do you have an hour to just come onto a call and maybe, we'll talk. And then suddenly you reach this call and you have your Miro board or whatever tool that you're using. You're taking notes, you're asking people. So it's really about just easing into the process. And I think that's what we found that has worked for us. Where it's not very official. Okay, the project starts now. This is the brief. Go. We need you on this date. But it's really, really very fluid and flexible. And we definitely try and work around the sort of time that leadership is able to offer. And the good thing is a lot of time you want to talk to frontline staff because that's where the actual, that's where you find out the pain points, the issues, what's not working. And they are more than happy to talk to you about what's not working for them And and then you sort of relay that back to the leadership. So the leadership are just sort of strategic decision-making points, but not so much about being involved in the sort of, solutions, if that makes sense.
Thank you. Just one more clarification. Is this the same as design thinking?
Yeah, I would say design thinking, I think, is a lot about sort of problem solving and, looking at it's an approach. And I think, over the years, so many design jargon and framework and things have evolved that they're all sort of related to one another. But I would definitely say that service design stems from design thinking, but has now become its own thing because of the framework, because of the methodology. That's my opinion. But yeah, I would say they're pretty similar. Radhika, do you have any other opinion?
I would actually say that. So I've also done the master's in service design, and I'm working as a service designer right now. I would say that design thinking is a methodology which can be applied to quite a lot of different fields. So it can also be applied to, let's say, service design. It can be applied to product design, and there are different parts of it that can be applied to different design fields or design processes. But I would also agree that to quite an extent they are very, very similar. But to me, service design is a broader term because there can be so much more that you can do in service design. But design thinking is quite an established framework that is already in place. It's already implemented. So I would think in that manner. Yeah.
Thank you.
Anything else?
Yeah. No, that's it. Thank you.
Okay, great. Thanks for your question. We have another question by Matthew. And Matthew, again, just introduce yourself and ask your question right away.
Yeah, sure. Hi, guys. Yeah, so I've worked in public sector quite a bit myself as a civil servant and different things, and worked with a lot of service designers, etc. I was just wondering, though, I'm working with a new team at the moment, and some of the sort of I guess there's limited budget to do things. So some of the UX designers want to sort of do a bit of service design as well. Is there sort of a place you would recommend getting training on this if you don't want to, say, do a full degree or anything like that in it, So are there any quick courses that people can take?
Yes, definitely. So I studied at the Royal College of Art, and I think they have this service design masterclass that people from my team in the council have actually done it, and they seem to like it. I haven't done it, so I don't know, but they seem to like it. So yeah, that could be something that you could try. I think it's like a 5-day masterclass where it's 5 days of some intense sort of group working and learning about different tools and techniques. And I think you need to come with something that you want to work on yourself, like probably your organization's priorities or things like that. So it's quite, it's sort of made to help you in your practice. So yeah, that's the only one that I know of. Just the same from it's by the same university, Royal College of Art.
Brilliant. Thank you very much. Yeah, and thanks for the talk as well.
Thanks for your question, Matthew. I think we have one last question here by Vikram. Once again.
Yeah, so I think, I just wanted to find out, were there any interesting moments or any worst kind of moments you have actually dealt with in your career so far?
Worst moments. I'm trying to think. I think for me, it's just when, I think I mentioned this a bit when I was talking about I was trying to answer another question, but it's about when you've spent, I don't know, months trying to do something and then it just completely fails. It's always heartbreaking. And, maybe in theory it really works, but people just don't have the time to move forward with it. They don't have the time to implement something new. They're like, we don't have the time to change. We're just going to go with the way we've been working for the past 10 years. And that's definitely heartbreaking. And those have been some low moments where it's, very frustrating of we've spent so much time, energy, effort. We know it can make a difference, but you just can't do anything about it. And I think that would be maybe some challenging moments. Yeah.
Thanks.
Thanks a lot for your questions, everyone. Does anyone have any other questions? Any dying questions that anyone wants to ask Saumya? Okay. Maybe one last question from my side. I know we're a little above time, but just give us like a few more minutes. When you're talking about measuring success, right, or measuring the impact of what you've created, how easy is it? How easy is that to do? Because sometimes you're not creating tangible products. Sometimes you might create an experience as well, and it might be difficult to measure.
Yeah, no, I think sometimes it is difficult to measure, but I think you have to find a proxy, because I really believe in measuring success, because that's the only way you would know it works as well. And I think anecdotal evidence is obviously nice, where you ask someone, what did you think? And they say it was great. Okay, fine. But, actually seeing how many times someone uses something, or actually seeing how many times someone interacts with your service, I think those can give you numbers as well, and those won't lie. So I definitely think it's a mix of both quant and qual sort of evaluation, and even feedback surveys. I think those would be helpful, where you're just trying to document something in a slightly more robust way than just asking someone, how was it? So yeah, it's difficult, but I think it has to be done, and you just have to find a way to do it to fit your context.
Okay. Yeah, totally agree with that. Thanks a lot, Saumya. I think this session was really informative for all of us. And I'm sure a lot of you have, something to take back from it as well. Whether you're in the design field or whether you're, in a non-design field as well. And do look forward to, our next few talks and upcoming workshops as well, that we definitely want to have workshops on service design, and want to call back experts and experienced designers like Saumya, who can help facilitate the workshop as well along with me. Yeah. Do watch out for our upcoming talks, by Mavelyn Lowe, who will be talking about product design. She's a senior product designer at Grab, and soon she'll be moving to London for newer endeavors. So this will be happening somewhere in July. And once again, follow us on our Slack channel. Just scan the QR code right away, and just follow us so that you can be updated, and you can join our design community. To stay in touch with us, and to just be part of something that's growing. Yeah. Thanks a lot, everyone. I'm just going to leave this here for people to scan. Yeah.
Thanks, Radhika. Thanks for having me.
Thank you.